Welcome back, viewers. You're watching the Savera and I'm Shefali. Pediatric cancer is a heart-wrenching diagnosis that no parent ever wants to hear. While most cancers in children are not directly inherited, recent research has shed light on how genetics can play a role in the development of cancer in young patients. Understanding the genetic factors behind pediatric cancer can help parents make informed decisions and advocate for the best possible care for their child. As we will explore the role of genetics in pediatric cancer, how genetic mutations contribute to cancer development, and what every parent should know. Let's dive in. What is pediatric cancer? Pediatric cancer refers to cancers that occur in children and adolescents, typically under the age of 18. While cancer is most common in adults, pediatric cancer, even though rare, can be equally devastating. Common types of pediatric cancer include leukemia, lymphoma, brain tumors, neuroblastoma, Wilms tumor, and bone tumors. Unlike adult cancers, which are often linked to environmental factors or lifestyle choices, pediatric cancers tend to have a different cause and sometimes involve genetically factors. Genetics play a significant role in the development of cancer. In children, certain genetic mutations or inherited conditions can increase the risk of developing cancer. In most cases, these cancers are not passed down directly from parent to child, but rather arise from spontaneous genetic mutations. However, some children inherit genetic mutations that predispose them to certain types of cancer. The role of genetic testing. Genetic testing can play a crucial role in identifying children at higher risk for cancer. Through a blood test, doctors can screen for inherited genetic mutations and provide insight into the risk developing certain cancers. If a family have a healthy history of cancers or present with symptoms of a genetic syndrome, genetic testing may help guide medical decisions. The role of genomics in pediatric cancer. Genomics have voluntarized the understanding of pediatric cancer by studying both the child's and tumor's genetic makeup. Tumor profiling helps provide a precise diagnosis and tailored treatments to larger specific genetic mutations, improving treatment efficiency and reducing unnecessary interventions. Additionally, genomic testing genome testing aids in early detection by identifying children at higher cancer risk, enabling closer monitoring and early interventions for better outcomes. What every parent should know. As a parent, it is important to understand that the majority of childhood cancers are not directly inherited. However, some genetic conditions to increase a child's risk, and early detection through genetic testing can help identify potential risk. Not all pediatric cancers are genetic. Most childhood cancers are often due to spontaneous mutations, not inherited conditions. However, inherited genetic mutations can increase the risk of certain types of cancer. Genetic testing can provide valuable information. If your child has a family history of cancer or exhibits signs of a genetic syndrome, genetic testing may help identify potential risk and guide treatment. Genetic counseling is important. If your child is diagnosed with cancer or if there is a family history of cancer, genetic counseling can provide support and guidance. A genetic counselor can help you understand the results of genetic results and help make you informed decisions about child's care. Early intervention improves outcomes. Inherited genetic syndrome can sometimes be detected early, leading to closely monitoring and earlier interventions, which can improve the chances of successful treatment. Early detection through genetic testing offers opportunities for more precise and effective treatment plans, which could significantly impact a child's chances of recovery. For parents, staying proactive and seeking genetic counseling when appropriate can make a real difference in navigating complexities of pediatric cancer. By equipping themselves with the right knowledge, parents can ensure that they are the most making informed decisions for the child's health and future. The majority of childhood cancers are curable, especially if detected in early and managed in a proper manner. That's all for now. Stay healthy, stay safe, download the Savera app and follow us on Facebook, Instagram, Twitter and YouTube.